Hello, HHT community, and welcome to our latest webinar. Today, you will have the opportunity to learn all about how you can become an HHT Changemaker by educating your local providers through our new project for continuing education for physicians. When we say awareness about HHT saves lives, we mean it, and you can play a role in that effort. But more on that in just a bit. My name is Riley Blevins. I'm the Senior Director of Global Community Engagement here at Cure HHT, and I will be moderating tonight's session. But before we jump in, I first wanted to make you aware of some important news and announcements we have going on at the Foundation. First, we're nearing the end of National HHT Awareness Month in June, which is an important fundraising period for us here at the Foundation. This year's campaign is HHT Changemakers, and we're inviting our community members to join our community of changemakers with a gift today. I do have a bit of a tease for those on our webinar here tonight. Please stay tuned to our social media channels and our emails tomorrow. We have an exciting giving announcement ahead of Global HHT Awareness Day, which is this Sunday, June 23rd. You won't want to miss that. Look, in all transparency, we're a little short of our goal of raising $200,000 this June, so please do consider giving generously. The reality is, if we want to see the changes all of us as patients, myself being a fellow patient, want to see, it is up to us to get it done. Tonight, our webinar is being brought to you by Bleed Cease. Stop bleeding fast and easy. You can click the link in the chat to receive a free sample pack of Bleed Cease. We thank them for their generous support and partnership this June. Also, we are excited to share our 15th HHT International Scientific Conference will be held at the Pullman Mandalou Bay and Mandalou La Napoule, France on October 15th through the 19th, 2024. This conference is one of the more meaningful ways we advance treatment and care within HHT. The conference, it fuels collaboration and sparks dialogue amongst the world's leading physicians, researchers, and scientists. Registration is now open. I will divulge, we are set to break some records with this conference in terms of number of abstracts, posters, oral presentations, and more. Cure HHT, we continue to invest in growing the medical community who focuses on this disease, which ultimately impacts you, the patients. Next, as you will hear a little bit more about, participating in research is perhaps one of the most meaningful ways you can contribute to a brighter future for our disease and its patients. We just expanded the criteria for our newest clinical trial, the pazopanib study. Check out our website for more information and to see a recording of a webinar that might help answer your questions. If this trial is successful, this drug could be the first FDA-approved medication for HHT, a huge milestone, but we need more participants. We do have several other research projects underway. You can learn more about things like the Brain Vascular Malformation Consortium and tissue donation by visiting the research section of our website. Oops. Finally, before we get underway, I want to go over a few housekeeping rules for the webinar to make this event as successful and interactive as possible. First, if you have a question tonight for our presenter, please type it into the Q&A box to the right of your screen. We recommend that you keep your questions general in nature so they benefit everyone. I will ask as many questions as time allows. We will post resources relevant to tonight's chat in the chat box. You can use that chat box to make comments to either an individual or all participants on this webinar, but please do not post your questions in the chat box. Questions for the presenter must be typed into the Q&A field. This presentation is being recorded, and a recording of the webinar will be saved in the Cure HHT website's resource library. And at the end of this discussion, you will be emailed a brief survey. Please do take a minute to fill that out, as your input and feedback is critical for the development of future webinars that most impact you, the patient. And with that, let's get underway here. It is my pleasure to introduce tonight's speaker, our very own Melissa Dickey. Melissa Dickey joined Cure HHT in August of 2022 as a director of the National HHT Coordinating Center. Prior to joining Cure HHT, she practiced as a nurse practitioner for more than 20 years. She's been a coordinator at 2 HHT Centers of Excellence and has 8 years of experience treating more than 500 HHT patients. I don't want to speak for Melissa, but if you have some questions regarding HHT, please feel free to ask those tonight as well. At the end of the presentation, again, we will hold a 15-minute moderated Q&A session. And with that, Melissa, I'll turn things over to you. So please turn on your camera and feel free to share your slides.
Thank you for the lovely introduction, Riley, and thanks to all who are attending today. I'm going to share my screen now. Sorry, we practiced this before, but give me a minute. All right, can you all see that?
We can, yep.
Okay, perfect. Again, my name is Melissa. I am the National HHT Coordinating Center Director, and I have many years of experience caring for HHT patients. I'm here today to talk about our new continuing education program for providers, and to further talk about how you can assist with getting the word out. Just a little bit of background. In 2022, Cure HHT received a grant from the Health Resources and Service Administration, also known as HRSA, which is through the U.S. Department of Health and Human Services. It was awarded to Cure HHT to support a hereditary hemorrhagic telangiectasia program. And this grant is a three-year program that goes from September of 2022 to September of 2025. The purpose of this program is to reduce morbidity and mortality associated with HHT by funding this national center to expand access to and coordination of care for HHT patients, and develop a de-identified aggregate data collection registry to better understand HHT and its treatment outcomes. So through this program, we've developed and launched a data collection registry called CHORUS. CHORUS stands for the Comprehensive HHT Outcomes Registry of the United States. We've provided annual awards to 15 of our HHT Centers of Excellence to support staffing, to allow them to increase their volume of patients seen, and also to enroll patients into this registry. We've also developed and launched the continuing education program, which we're going to discuss further on this webinar. Again, this is a 3-year grant, but Cure HHT, HHT patients and providers have been lobbying for the government to provide continued funding past the 3-year period, as well as to increase our funding amount to allow us to fund more centers of excellence around the country. So more to come on that. We attended Capitol Hill Day back in March to address this, and more information to come as government can take a long time in their decision-making process, but we will be making announcements as we learn more. So the continuing education program, just a little bit more about the reasoning behind it. Cure HHT has always been committed to raising awareness and providing education about HHT to the medical community. As you know, we host lots of webinars. We sponsor the scientific conference every 2 years to bring the medical community together to really further the advancement of HHT and its treatment. We launched this program the end of 2023, so the providers can take courses and learn more about HHT on a variety of topics and earn free continuing education credits. Anyway, these continuing education credits are required annually for providers such as physicians and nurses to renew their licensure, and so it benefits them in learning more about HHT, but also helping with their license renewals. Just some key statistics on HHT. A lot of this you may already know. 25 years is the average time from the first symptomatic visit to a physician until diagnosis. 9 out of 10 people with HHT are undiagnosed. Lung and brain hemorrhage, stroke, brain abscesses, and death are all preventable complications of AVMs, or arterial venous malformations, if diagnosis and screening occur early. Approximately 50% of patients suffer from anemia and iron deficiency, which can cause symptoms such as fatigue and migraines, and often can lead to ER visits and hospitalizations. It's estimated that approximately 1.4 million worldwide have HHT, and this is estimated to be about 70,000 patients in the US. Sudden death or disability occurs in about 20% of undiagnosed children and adults. So, to summarize, HHT is a manageable disease if it's identified and treated early in life. It's widely unrecognized in the medical community and the community at large. And all of these things reinforce the importance of educating the medical community about HHT to foster early diagnosis and comprehensive management of the disease. I'm sorry. The continuing education. Oops, I'm so sorry. So why this program matters? Many patients do not have access to the resource or access or the resources to receive care at a center of excellence. We have 28 centers of excellence in the U.S. currently. So this certainly means that patients have to travel far and wide to get to a center, and this is not always possible or feasible. Local non-HHT providers, such as primary care physicians, pediatricians, and hematologists play a key role in managing HHT patients that cannot get to a center of excellence on a regular basis. There's a general lack of knowledge about HHT in the general medical community. So therefore, HHT patients play a key role in educating their local providers about HHT. Oftentimes when patients visit a center, and I've had these conversations many times over, when they go to an HHT center, this is the first time that they meet physicians that are actually familiar with the screening and management of HHT, which is unfortunate. So, we have an obligation to educate the providers in the local community. This is just a little bit of information about how we developed this program. We partnered with several groups to develop some priority topics and develop courses and presentations on these topics. We have a continuing education steering committee, which is a group of expert providers that are very well versed in HHT. We've been working with Washington University School of Medicine in St. Louis to help accredit these courses so that providers can receive credits that go towards their license. And then we work with expert providers who were gracious enough to donate their time to assist with the development of this program and its content. The purpose of the continuing education program, healthcare providers have the opportunity to recognize HHT in their patients and direct them to the care that they need. But they've got to know about it and be familiar with it before they're able to recognize it in their patients. This program provides a platform where healthcare providers can further their HHT knowledge and receive these continuing education credits. It allows us to develop presentations and courses that focus on the importance of diagnosis, screening, and disease management for HHT patients and their families. It also, in general, increases awareness and recognition of HHT in the medical community. This is just a little information about our continuing education partners and collaborators. Again, we are working with Washington University to accredit these courses for providers, and the HRSA, the Department of Health Resources and Service Administration, is providing the funding for this. So we've got two portions of this program. The first is an online learning program. This is an online platform where providers can go online and take courses at any time and receive credits immediately at their convenience. Currently, we have 5 courses available, and these are our online courses that we have currently. You can see there's a variety of courses that we've launched. Some are more general, like diagnosing and standards of care, management of pediatric patients. And then we have more specific ones about managing iron deficiency and anemia, pulmonary AVMs, epistaxis or nosebleed management. And these courses are all about 25 minutes each, and providers can take them. And once they've taken them, they can go back at any time and reference them. So it's a good resource for the providers. You may recognize some of these providers on here that have developed and developed these courses, as they're all HHT providers that are HHT Centers of Excellence. What we've achieved with this online learning program, again, we've launched 5 courses. The first couple of courses launched in September of last year, and our most recent one launched in April. To date, we've had 180 healthcare providers register for this online learning platform, and we've issued about 100 online course certificates for the program. The providers have to take a course evaluation after to give us some feedback on the courses. 100% of providers have reported that these courses has increased their knowledge of HHT, and 80% of the providers that are non-HHT Center of Excellence providers reported that taking this course has enhanced their ability or fostered their interest in accessing an HHT Center of Excellence to help care or co-manage the care of their patients. I think that this demonstrates, the impact of the courses have had so far, and the importance of getting these out to the medical community. The second portion of the program is an on-demand learning. What this is several presentations that have been pre-developed, and providers can go online and request a course to give to their local medical community. And once they complete that form, Cure HHT will get in touch to help coordinate the event. These courses are longer courses. They're about an hour long. They can be given virtually via a webinar or a Zoom like this, or we can coordinate a live event and give these events in person. These are our on-demand presentations to date. We have 7. You can see again a lot of potentially familiar names that have helped in developing these in several different with several different disease manifestations. Again, some of them are more general as well. We've got 7 presentations launched, and we're currently accepting requests for these presentations. We have 31 expert providers that have applied to be and have been approved to be designated speakers for these courses. So once we get a request out there, we can assign a provider that is, optimally local to the institution or provider that's requesting the talk. And then we help execute it. And we've done a few so far, which I'll talk about on the next slide. So again, we have our National HHT Patient Physician Conference every year, and our 2023 conference was in Bellevue, Washington, near Seattle. We had 21 healthcare providers that attended 7 different presentations and received continuing education credit for these courses. 5 of these courses were turned into the online courses that we have that physicians can take at any time. 4 of the presentations that I just showed you on the last slide were delivered at the National HHT Patient and Physician Conference in April in Philadelphia, where we had 25 providers attend and receive credit. We received a request from Vanderbilt University in Nashville to deliver some of these talks, and we actually gave 2 presentations in April, and we had 14 healthcare providers that attended. This was very beneficial because Vanderbilt University in Nashville is interested in becoming a center of excellence. So it was a perfect opportunity to start educating those providers as they go through the certification process. So hopefully within the next year or so, we'll have we'll have an HHT center in Tennessee for those of you who live in the area. What's to come? We do have 4 online courses currently in development, and we hope to launch those by the end of this year. We've got one in genetics. We've got one on pregnancy and HHT, which I'm very excited about. We've got a special course for school nurses to help educate school nurses about how to address, kids that come into their office with nosebleeds and HHT, or even how to recognize, potential HHT patients when they come into the office with symptoms or nosebleeds. We've got 3 on-demand presentations coming soon, and we hope to launch those in by the end of this year as well. We are coordinating some on-demand events with some institutions currently to educate their local providers. And we're also working to spread the word about this program. We're working with professional societies. We're reaching out to providers in our roster. We're having other organizations that we work closely with, provide this information to their providers, so we can really have a broad reach to the medical community at whole. What can you do? So again, it's important that patients are involved in educating their local providers about HHT. So one thing that you can do is spread the word. Share this information to your local providers that may benefit from some additional learning about HHT. For instance, if you have a local hematologist that's helping to manage your anemia, they can take that course and learn some more specifics about how to better manage your anemia locally. We do have a flyer. The link is on this, and I will and it's also on our main webpage. You can scan this QR code and it'll get you right to that page. But you can print out that flyer and you can give it to your providers and specialists in your community today. You can also email it to them. It's a PDF, or you can just provide them with the link to the website. Every new diagnosis allows entire families of patients to receive proper screening and treatments to help avoid unneeded tragedies and loss. We all can play a role in expanding the knowledge about HHT. So this is your call to action to help educate providers in your community. This is just another slide that kind of reinforces the information that we provide, that we can give to providers, and has the accreditation information on it, which is not really important to you, but is important to the physicians, nurses, pharmacists taking these courses. Just a quick shout out to an upcoming event that we have. For those of you that live in Northern California or have family or friends that live in that area, we do have a UCSF Kids Day coming up in September. It's on Saturday, September 7th. And it's going to be held at the California Academy of Sciences in San Francisco. This is an opportunity for patients and families to get together, for kids to meet other kids with HHT, share experiences. It'll include kid-friendly education sessions, parent education sessions. You'll be able to meet the specialists at the HHT Center of Excellence in San Francisco and ask questions. And it even includes museum admission. It's free, and we encourage you all to attend and to spread the word. We do have an interest form that you can fill out now by scanning this QR code. We ask that you do that as soon as possible. This helps gives us an idea of how many people are interested in coming, the ages of the kids, so we can help tailor the event based on who would like to come. We should have a registration page going out in early July, and the people that fill out the interest form will be the first to get that registration link. Space is limited. I think we've got about 75 spaces for patients and families. So if you're interested, fill out this form and register early. Lastly, just our general Cure HHT information. If you have any questions regarding anything that we've talked about today, after this webinar, you can always reach out via email to our info email, which is on our website, or you can call us directly, and I'm happy to talk to anyone about any of these exciting things that are going on. And lastly, just wanted to thank all the people that have supported this program, and the dedicated Cure HHT staff and HHT providers who have volunteered their time to work on this continuing education program. I'm going to stop sharing my screen, and I'm open to questions.
Awesome. Thank you so much, Melissa, for the great presentation. Hopefully all of you enjoyed it as well. We'll now kick off the Q&A portion of our session here. But to buy everybody some time to ask your questions about the CME program, how you can spread the word and spread HHT awareness, or given Melissa's background, if you have an HHT question or two, I'm sure she'll entertain a few of those if able. Just want to say this is really timely discussion with June being HHT Awareness Month. As Melissa mentioned, with a prevalency of 1 in 5,000, HHT is a not so rare disease. So you simply never know the impact it will have if you share more about this program with your local providers. For example, Global HHT Awareness Day is this Sunday, June 23rd, and that's not a date that was chosen at random. June 23rd is Grace Nolan's birthday, who tragically passed from complications from undiagnosed HHT at 9 years old. She went to the hospital 9 times and left without receiving an HHT diagnosis. So that tragedy, unfortunately, would have been preventable with more HHT awareness. So please do take the responsibility seriously, download that flyer, and share more information with your local providers. It does look like we have a question in the chat here from Julie. And Julie, apologies if I'm misreading the question. Feel free to retype it and I can re-get to it. She's asking, I think, Melissa, what physician types that the CE program is recommended for, specifically mentioning RNs and registered dietitians.
Yes, it's open to anyone. The credits that are offered are what are called AMA credits, which is American Medical Association, which can also which can be used by pharmacists, I believe by dietitians, genetic counselors, and then we also offer credits through the ANCC, which is the nursing credits for nurses and nurse practitioners. We've got a variety of courses that I think everyone can benefit from, and providers can go on there and look and see what is most interest, what is of most interest to them. We don't have a talk specifically about diet. It's always a touchy subject with HHT because everyone is different and reacts differently. But they're certainly welcome to join any provider. We've got ones that are tailored more for hematologists. We've got ones that are tailored more for interventional radiologists that treat pulmonary AVMs. Kind of runs the gamut. We've got several epistaxis or nosebleed talks. So those are of course for your ENTs or otolaryngologists, depending on what they go by. We've got pediatric talks. I think, internal medicine or primary care physicians could really benefit from some of our more general talks. So any provider that helps to care for you, that you want to learn more, that you think could benefit from learning more about HHT, there's a course for them.
Awesome. Thanks, Melissa. I hope that answered your question, Julie. We have a few questions here as well from registration, so we'll get to some of those. I'm going to lump 2 questions into one for you, Melissa. The first is asking if practitioners in the UK can benefit from these continuing education programs, and the second is, can international providers? So can UK providers and international providers more broadly take these courses? Yeah,
any provider can benefit from these courses. Whether or not they can use the credits towards their licensure it's dependent on the country that they live in. So I think Canadian providers, for instance, can take these courses and use a portion of them towards their license. So I guess to sum up, it depends on what country they live in, but they can all benefit. They just may not receive the continuing education credits that they can actually use towards their renewing their medical license, nursing license, et cetera.
Awesome. Thanks, Melissa. We have one coming in live here from Mary Jo, who's asking if school nurses are required to have continuing education.
They are. Any nurse is required to have continuing education, and we do have one of our talks that's being worked on now is specifically for school nurses. So that should be up hopefully by the end of the year. But I think that school nurses can definitely benefit from some of the courses that we already have up there, like the medical management of nosebleeds.
Good to know. We have another question here from Kathy, who's a patient and a nurse. Doesn't sound like she's working at this time, but wondering if she can get CEU credits as a nurse.
Yes, we offer ANCC credits that are specifically for nursing license renewal.
Great. Let's see, going back to some of these questions we got in registration, have one if this is open to nurses. I think we've touched on that one. How much does this cost? I know you covered this, but worth reiterating for doctors and physicians.
Free. Any courses taken is free. Any event that is requested, it's not free, but it's free to the providers that attend. We're using the grant funds to pay for this to ensure that providers, don't have any reservations in coming and taking these courses.
Awesome. Thanks for that, Melissa. I'm not seeing any more questions at this time. So with that, I want to thank you, Melissa, for the time you put in this presentation and for giving this information to the community. Again, please do share that flyer. You can find it on our website. Actually, Melissa, before we leave, do you want to share your screen and show everybody where they can find more about this program on our website?
Sure. So this is our homepage here, curehht.org. It was up here recently, but these tiles up above are constantly changing. If you go to news and resources, if you come down here, to continuing education program and click on that, this is our homepage that's got information about the online learning and the on-demand learning. You can click through that to get to where you want to be. You can also type in to the search bar, you can type in CME, which stands for continuing medical education. It'll bring you to this page. You can type in continuing education, and it'll also bring you to this page. So if you forget where that is, you can do a search, and it's going to take you to, it's going to be the first thing that pops up. Just a quick note, down at the bottom of this page, and it's on most of our pages, but if you where it says spread the word, share the continuing education program flyer, if you click on this, that's going to take you directly to that flyer. You can save it as a PDF and email it to your providers. You can print it out and bring it to your providers. And just a quick note, this is we're spreading the word and sending this out to lots of people. They're also included in new patient packets, so that when patients go to a center for the first time and they receive their packet, they're going to get this flyer with some instructions to provide it to their local providers as well.
Awesome. Thanks for that overview, Melissa. And again, for the time tonight, thank you everybody for joining us. I will leave you all with this. You do not have to be a researcher or a physician to be an HHT Changemaker. You can be a changemaker today by doing something as simple as sharing that flyer with your local physicians. As like I said, you truly never know the difference it might make. You can also become a changemaker by donating to our June Awareness Month campaign today. To put it simply, if we want to see the changes all of us as patients want to see, we could not continue our life-saving work at Cure HHT to enhance the way this disease is understood, treated, and cared for without your financial support. So we appreciate you doing that today. With that, keep an eye out for our email asking for your feedback so we can bring you future sessions that address topics that are interesting and meaningful to you. And enjoy the rest of your evening, everyone. Thank you.